Hello, everyone, and welcome back to Channel Dad Bryon Lape. And here we have something. Now, this is from CNBC. So people didn't like when I had some Blaze and Fox News stuff. Okay, I get it, but I try to read as much as I can from everywhere. Really helps point out the bias. So I saw this floating around yesterday, basically, and this is encouraging to me because this is the kind of thing physicians who have actual experience with COVID have been saying for 2 months. And why they've been saying, if you want to wear a mask, but you don't need to. And yet governors, I know where I live in Ohio, our governor is full of himself and he's got people scared out of their wits. I don't wear a mask. I'm not asymptomatic. And even though I was, this says not to. The World Health Organization has already said, and I did a video on it 2 weeks ago, that wearing masks when you're not expressing any symptoms is stupid unless you're treating somebody. If you're outside of the healthcare facilities, if you feel like crap and you're coughing, okay, wear one just in case. Now, a lot of people have been arguing with me over that. I'm like, look, yes, it'll stop the globules. Of course, now they're going to be rebreathing that back in, which is not going to help them because now they really need a change mask. But the particles themselves, the virus and all that goes right through it. It goes right through an N95 as well. So in either both directions. So you're really not being protected from yourself. You're just making things worse for your own health by rebreathing your CO2. So this is very interesting. So they've already backed away from masks. Now they're backing away from asymptomatic. Spread of virus is very rare. Okay, now some people are saying that this is zero. It's not zero. They're not going to say it's zero. It's probably very, very, I don't know. I haven't read the article. And in keeping with YouTube guidelines, they're saying, and if you're going, I don't want to begin the video. I'm not going against the WHO here. I'm actually quoting them, and I've quoted them multiple times, even about Sweden and everything else, and people have still read me. And some of those videos have been demonetized. I'm like, you said the policy was anything, I'm quoting the World Health Organization, YouTube. Okay. And, when they go over to BitChute, they get all kinds of views, but obviously no money. But, and some good conversations get started there too. So coronavirus patients without symptoms aren't driving the spread of the virus. The virus isn't spreading hardly at all anymore. Casting doubt on concerns by some researchers that the disease could be difficult to contain due to asymptomatic infections. So I have a theory on the asymptomatic infections, and mainly because also I've got another article that talks about it as well. It takes prolonged exposure. Now that can be a lot of time, or that can be a lot all at once. So it's either a little bit of virus, and if you don't have an already highly compromised, in particular, respiratory system. So my belief is this gets into someone's system somehow. Apparently the envelope's very weak. This is why the disinfectants and all that stuff work so well against this. And we've also had, now they've backed away from how well does it spread on other things, that finding RNA is not necessarily finding the virus. And so what I think is happening is people get exposed in very low doses, if you will. Who knows how many particles. The body, their immune system is not compromised or not compromised enough. It kicks in, it creates the antibodies, it destroys it, and then they're still floating around when they get their test done. Now, my brother he works for a hospital chain around, local chain. There's like 3 hospitals that are all connected, as a chaplain. And he's been talking to the doctors, and yeah, they saw a lot of stuff early on, back in early February, but nothing in a long time. They've had to lay off nurses. They're looking at losing a minimum of $300 million this year. Okay. So, that's serious. I mean, that's probably going to end up in layoffs and furloughs and everything else even more than they have, unless the governor gets things. I mean, the governor should open everything by now. We're in almost to mid-June, and this is insane at this point. But there's a lot of doctors who have treated a lot of patients that tested positive for COVID. Not a single one of them have any antibodies. They get antibody tests every week, and they keep coming back negative. So that's why I think there's, and it might be that maybe they got exposed, but, went through the mouth, let's say. and the acids or through the stomach. Let's say they were in the air and they breathed through the mouth and it got stuck in the mouth, and then they swallowed some, and the acids in the stomach and everything just rip it apart. This is why early on you saw people, if you had a sore throat, they were saying drink a lot of water to wash that down, because your stomach acid would take care of it. And I think it's part of what's going on here. And now, granted, I'm not a doctor, and it's just an assumption. But I'm doing a lot of research, listening to a lot of opinions, and it's crazy. Now I finally know of somebody I know of two people who tested. One guy's in South Africa, and his kidneys are failing. Now, he was traveling around the world with his wife in a boat, and I know his brother. So. And his brother's my dad's age. So his brother's in his 70s. So this guy's, I think he's a little bit younger. So let's say mid 60s. But what I think is happening is something else let's say he's got COVID, but something else is what's shutting down his kidneys. And when I've heard doctors talk about it, it's amazing. You swear they're talking about different. One guy, 13 different patients all express different things. But let's get back to the article. Some people, particularly young and otherwise healthy individuals who are infected by coronavirus, never develop symptoms or develop very mild symptoms. Yep. Others might not develop symptoms until days after they were actually infected. Preliminary evidence from the earliest outbreaks indicated that the virus could spread from person-to-person contact, even if the carrier didn't have symptoms. But WHO officials now say that while asymptomatic spread can occur, so they're not saying it's impossible. This is the same thing with the cell phones. The cell phone they can't say it's zero, but it's so small it might as well be zero. The cell phone's interfering. For the most part, so that's why they make you turn them on. There's two reasons really why they make you turn them on. One, it's not zero, so someone could argue that in court if something were to happen. And two, they really want you paying attention to what's going on during a takeoff and landing in case something goes wrong, right? If you're at 30,000 feet and something goes wrong, you've got a lot of time to prepare, even if it's just falling out of the sky. But coming down for a landing where the margin of error gets smaller and smaller and smaller, if something were to go wrong and you need to evacuate, you need to be paying attention. But who could say it's not the main way, even early on, doctors are saying it's a very weak virus as far as structurally. It can be nasty, but it has a very, low threshold as far as being able to be defeated. From the data we have, it still seems to be rare that an asymptomatic person actually transmits onto a secondary individual. It's very rare. So that's this head of the Dr. Maria Van Kerkhove. I don't know if that's her there. Okay. But I don't want to start a video here. I don't want to get copyright strike for playing a video on CNBC. Government responses should focus on detecting and isolating infected people with symptoms and tracking anyone who might come in contact. Now, this is the tracking stuff again. China's already doing it, but a lot of countries are starting to push back on this. She acknowledged that some studies have indicated asymptomatic or pre-symptomatic spread in nursing homes. And again, so you have a very confined space. This is also why lockdowns do not work. Okay. This is why the governors of New York and California ended up killing a lot of people, because they were following extremely stupid ideas. I won't even say bad advice. The research has been done. The papers have been written. Lockdowns do not work. Okay. You can isolate those who are sick, but if you lock them in with people who are healthy, you can make them, again, it's in confined space and prolonged exposure. You go into the store, even if someone 6 feet in front of you coughs into the air and you walk through that and get the virus in you, it isn't enough of an infection unless you have a highly compromised system. And then if you do, and you're not literally wearing a ventilator, ventilating mask. Okay. So something like a gas mask, something that is full filtered. Really, if you don't have your own oxygen supply and it's output only, that is really the only way not to get, and you got to have your face not just a face mask. You need to have a hood on. Okay. If you look at what they do now in some of these research labs, that's what you have to be wearing. Now, getting it on your skin and other things, as long as you wash don't put your hands to your face and stuff like that before you wash them, you're probably okay. But the eyes and the nose, and I see a lot of people wearing masks below their nose, and the eyes is another thing. So you need to have more than just a face shield. You have to be fully covered. So most people aren't wearing that, and they don't have their own oxygen supply. So this is where almost like a scuba tank, right? It's output only. The way a scuba mask works is that it's output only. That when they breathe out, the CO2 and expelled oxygen goes out, but water doesn't come in. And that's the only way you're going to be fully safe walking around. We have a number of reports that countries who are doing very detailed contact tracing, they're following in asymptomatic cases, they're following contact cases, they're not finding secondary transmissions onward. It's very rare. And that makes perfect sense and I think that's true for most viruses. And this is why, and people try to compare this to the Spanish flu is insane. Okay. Over 1 million Americans were killed. Depending on which source you read, 1 to 4 million Americans died. Some will say it's lower, some will say it's higher. It's 40 to 50 million people worldwide is an estimate, and yet there are some estimates that will claim as much as 100 million worldwide over the 2.5 years that was a problem. So let's just take 45 million. Let's split the accepted numbers in half. World population is less than half of what it is today, so you can do the math. And raw numbers were not there, and by percentage-wise, we're not even close. These findings also suggest that to control the pandemic, it might not be enough for only persons with symptoms to limit their contact with others, because persons without symptoms might transmit infection. What? And an asymptomatic spread proves not to be a main driver of I missed the whole paragraph. Transmission. The policy indicates the policy implications could be tremendous. A report from the U.S. Centers for Disease Control, published April 1st, cited the potential for pre-symptomatic transmission as a reason for the importance of social distancing. Okay, so that's what they were quoting then, but that's bogus now. To be sure, asymptomatic, pre-symptomatic spread of the virus appears to still be happening, but remains rare. And now, granted, how rare is rare? That finding has important implications for how to screen for that. So, again, looking for people's temperatures and all the other BS that's going on is not effective. And people can have a raised temperature for all kinds of reasons. What we really want to focus on is following the symptomatic cases. If we actually followed all the symptomatic cases, isolated those again, and this right here, even an idiot like me can find the research that's already been done. That D.A. Henderson and his team published, was that 2006? Okay. This is exactly what they discovered. This is what you need to do. The people that are sick, isolate. This is what we've done in the past. Now, sometimes it takes a while to find those people. And in particular, we didn't have a healthcare system that was encouraging people to show up at the doctor, right? So we have like ERs and stuff like that now that you can show up and get treated even if you don't have insurance. And what do? We tell people to stay home, stay away. We made it worse. So there's a very good possibility that if we would have said, look, if you have symptoms, don't go to the doctor, the ER, unless you have an actual emergency. You're showing symptoms, you break your arm, you're bleeding, you're shot, something like that. Not for sniffles, not for a cold, not for any of that other stuff. But you've got severe problems, you're having trouble breathing, go to the ER right now, okay? I think we would have been over this nonsense a month ago, or maybe even 2, depending on how you really want to look at it. Because the more and more data is starting to show that the peak was actually before lockdowns started, at least in the U.S. So you can, I'm not a fan of Trump. You can poo-poo him all you want, but we really did. Our response was insane, and Western Europe as well, and Ireland's. I mean, they're so far. They're now in lockdown. It's like you guys should have. Never mind. But lockdowns don't work. So again, we have the World Health Organization backtracking actual data, right? Not models, and which all have shown to be bad. And the Imperial College has been shown to be bad for 15 years. Why anybody believed them now is beyond me. Programmers have looked at the code, they say the code is bad. They've looked at the data, they say the data is bad. They've looked at the doctors have looked at their assumptions. They've looked at the assumptions of infection rates, all of it bad. So you multiply all that out and you get the nonsense that we had. So I find this encouraging. This is yet another step toward real data, and people need to calm down and get back to work and get back to doing the things. And if you show symptoms, isolate yourself to make sure it's not a cold. This is one of these things that everywhere I've worked for the last 20 plus years, maybe in 30 years, although some companies will say it, but they don't really mean it, If you have symptoms, stay home. Now, if you're working at, say, Subway and you're putting sandwiches together and you're the only person in that morning crew, that can be tough. I get it. There are certain jobs that's very tough to do. Or you're an hourly worker, you're not going to get paid if you don't show up. I get it. But take that in mind. Take a little bit of your paycheck and put it aside so that if you got something sick for a week, you could stay home and still pay your bills. Okay. So take care of that. And then if it turns out it's just a cold, here's two things that you're not. So let's just say it's a cold or the regular. Okay. If it's a cold, you're not spreading around the office, right? You're not then causing everybody else to get it and causing everyone to be out 4 or 5 days over the next 6 to 8 weeks, depending on your size of your office. Right. So there's a lot of productivity you're not affecting. And then if it is something more serious, you're not spreading it around. And that's how we should have handled this always. It's how we've done these in the past, especially once we knew stuff. Yes, 100 plus years ago, we didn't know as much. Plus, what people keep forgetting about the Spanish flu, World War I was going on when it started. It still started in Asia. It's called Spanish flu because they were the only country reporting it because they weren't part of World War I. They were, I don't know, neutral or just not involved. And then a lot of troops got it in the field because of, they're getting attacked with mustard gas and all kinds of craziness. They're under all kinds of stress. Yes, they're pretty young, but their health, their general picture of health is not great. And then where do they come back? They come back in Philadelphia and New York. And where do we get the second spike? Philadelphia and New York. So it's not just a case of they opened up too early. There was a lot of stuff going on. That may have been part of it. The influx of a lot of troops coming in. They're coming back across the ocean in cramped boats and ships and things. They're getting off not healthy, probably showing signs and everything. They're not sure what to do. They get a spike in those cities, and then it finally fades away into 1920. So there you go. This to me makes perfect sense. This also goes along with it not being very well. It doesn't live very well on surfaces. This also goes along with showing the masks are ineffective. It's much smaller than the masks, and even what some of the masks show is if you're as a healthy person or near someone wearing a mask who is showing symptoms, the reduction is only about depending on how you look at the math, 2.5, 2.7 percentage points. Okay. If they wear a mask, your rate is cut down to 5%. So, and it's either 2.5 or 2.7, depending on, and somebody say, well, it's 50% reduction. Yeah, it is, but not from 100. It's 50% from the 5, but from the 100, it's only 2.5 percentage points. So that also should show how ineffective the masks are for healthy people. So healthy people, get those masks off. But if you start showing symptoms, you start having problems breathing, get to your doctor, get to the ER and get isolated. All right. And then understand where you've been as you were sick. Not if you were somewhere asymptomatic, I wouldn't worry about it. And this is what they're talking about symptomatic cases. Once you have symptoms, know where you've been, and hopefully, again, self-isolate. People say it's common sense. None of this is common sense, unfortunately, anymore. And I don't know why. All right. Thanks for stopping by. Thanks for clicking like. And, and so, you can read this yourself and people make comments. Great. Because what do I know? I'm just some channel dad. Thank you. Goodbye.